Good afternoon, everyone. My name is Tarneka Manning, and I'm the Community Outreach Manager for the Metropolitan Chicago Breast Cancer Task Force. We're a nonprofit organization working to end disparities for breast cancer here in Chicago. To learn more about our organization, visit us at our website, www.chicagobreastcancer.org, or find us on Facebook and follow us at facebook.com/MCBCTF, or follow us on Twitter at our handle is MCBCTF. You're watching a live call-in television program brought to you on cable channel CAN-TV Channel 21, and we're online at cantv.org/hotline. During our show, we will discuss various topics related to health and here in Chicago. I invite you to call in if you have any questions during our show. Our line number is 312-738-1060. And our phone lines are open. All right, so today our guest is Dr. Stacy Lindau. Dr. Lindau is an Associate Professor of Obstetrician, Gynecology, and Medicine Geriatrics. And Dr. Lindau is the Director of the Program in Integrative Sexual Medicine, also known as PRISM, which focuses on women and girls with cancer to identify, prevent, and treat sexual health. Today, Dr. Lindau will discuss sexual health and cancer. So anytime you have any questions, give us a call. We're at 312-738-1060. So welcome, Dr. Lindau.
Thank you. I'm so happy.
Thank you for being a guest on our show.
Thank you.
All right, so can you tell our guests about your background?
Well, I'll be brief. I'll give you the short story in the background. So I am an obstetrician gynecologist. I practice gynecology at the University of Chicago. My focus is on helping women with cancer recover their sexual function after treatment for cancer. And I've been doing this now for several years.
Oh, great, great. So how did you become interested in sexual health and cancer?
I think my interest in the topic started with patients who I encountered when I was a resident at Northwestern University in Chicago. My patients would ask questions like, will I be able to have sex again after I have this treatment? When is it okay? When is it safe? Mm-hmm. And what I learned was there was not good evidence for how to answer those questions, that there hadn't been much research at that time on how to best counsel women about what to expect in terms of their sexual life after cancer treatment, mm-hmm. whether they could expect things to go back to normal or not. So it was really my patients who asked questions that I didn't have good answers for, and that stimulated my research and my focus on this area.
Well, that's a great way to stimulate research. So
yes, it's always the patient comes first. I always teach my students that patients' questions are the opportunity for discovery. And if you have a difficult time answering a question, you need to admit it to your patient, yes. And you need to then find the answer.
Great, great. So what are the cancers that most affect women's health?
Well,
sexual health.
Yes. Interestingly, of course, breast cancer is so common, mm-hmm. and it's among the most common cancers that women survive. Mm-hmm. Gynecologic cancers are very common. Lung cancer is common. Mm-hmm. What we've seen in our research and the work of others is that really any cancer type can affect a woman's sexual function.
Oh, okay.
So we tend to see more breast cancer and gynecologic cancer patients because these are the more common cancer types. Okay. But we see colon cancer patients and anal and rectal cancer patients. Head and neck patients with head and neck cancer might have difficulty kissing, or with other kinds of sexual activity. So it's really a more general issue than just specific to certain cancer types.
Okay. So what are some of the side effects of cancer on reproductive organs?
Yeah. So most cancers are treated with chemotherapy or radiation, mm-hmm. and these treatments can affect the functioning of the ovaries. Okay. These treatments target rapidly dividing cells in the body. Cancer cells are rapidly mm-hmm. dividing cells. And so by doing their job to rid the body of cancer, they can also affect the reproductive organs. Mm-hmm. Many of our patients experience abrupt onset of menopause. Some were already menopausal, but the ovaries are functioning even less than they were previously in menopause. Mm-hmm. And so those menopausal symptoms can be part of the picture when a patient presents for care for regaining her sexual function.
Okay. All right. So again, we are live. If you have any questions, give us a call. We're at 312-738-1060. All right. So can women learn to recover to normal sexual function?
Oh, absolutely. One of the biggest challenges in addressing women's sexual function after cancer mm-hmm. is just starting the conversation. Mm-hmm. So a big part of our work has been focusing on helping doctors understand that women with cancer value their sexuality Most women who develop cancer were sexually active in the year before, if not the 4 weeks before their cancer. And this is regardless of age. We study also sexuality in the context of aging. If a woman has a partner, whether she's 60, 70, or 80, the frequency of her sexual activity is about the same. And women who don't have partners come to our clinic for help to regain their sexual function because they see it as important to finding a partner.
Yes.
So these are some of the general issues. And yes, absolutely, if we can talk to women about these issues, that's the starting point. We can identify there's a problem, and then we can help. Ideally, we prevent these problems, and many of them are preventable just with education and open conversation.
Very true, very true. Education is key.
Yeah. Knowledge is power.
All right, so we talked a lot about the physical effects. So what are some of the psychological side effects from sexual dysfunction after cancer treatments?
Yeah. You know, it is really important to understand that the vast majority of sexual problems women experience after cancer are actually physical. They're the result of the medications, of the treatments. And again, those medications and treatments are important. They're life-saving, but they do physically and physiologically affect a woman's sexual function. And it's so important that we say that because oftentimes when women come to see us, because nobody's mentioned that they might have a sexual problem, the first thought is, it's just me. I'm alone. It's in my head. I'm not trying hard enough. And that can be, depressing at best and give women the feeling that, that there's just nothing that can be done. So the vast majority of problems are physical, and I do feel strongly that a woman who is having sexual problems after cancer needs to have a physical examination. It's very important, if for no other reason than to be reassured that her anatomy is normal, that she should be able to function normally. The psychological components are common, and there's worry. There's fear that sex might be painful, especially if a woman has had a treatment that directly affects her gynecologic organs, or even treatments for breast cancer can cause really severe vaginal dryness that can make sex painful. We've had patients express they were worried they could spread their cancer to their partner by sexual activity. And just by voicing that concern, we could reassure our patients that in very few cases is there any concern about risk of transmission of cancer to a partner. So the psychological issues, again, are oftentimes can be corrected with just basic education, and sometimes are even more serious and require the help of a therapist, a social worker. Some women are depressed or anxious, and having sexual problems can make those problems worse.
All right. So can you tell us about Prism Clinic, which you're the director of?
Yes. Well, first of all, I want to make sure everyone knows it's not prison. That was a mistake in the name. So Prism, like a rainbow. So Prism stands for the Program in Integrative Sexual Medicine, and we chose the name for the program because a prism casts a rainbow, and a rainbow signifies that we are open to all women regardless of their sexual orientation or identity, and that was the reason we liked the name. But the program is a clinical treatment program. We see women usually for an initial consultation of an hour and a second consultation where we do an in-depth physical exam and come up with a treatment plan. And then depending on the problem, some patients may benefit from physical therapy, some may need psychological support or sex therapy. And typically our goal is to have the patient solve her problem as quickly as possible because she doesn't need more doctors in her life. And we work closely with the cancer team in helping patients regain their sexual function.
Great, great. I think we have a caller. Caller, you're on the line.
Hello, how are you?
Hi.
Hi. I want to remain anonymous only because I feel that I need to, but I am a breast cancer survivor, and what worked for me was talking to other women that had been, that had the same illness, self-help groups, and more importantly than anything, and I know this may sound crazy, but I promise you prayer is what really helped me. I just kept praying, and I kept praying, and I kept praying, and I never stopped. And what really helped me with my whole process was just talking to other women that was affected by the disease as well. You do recover, and you can be a survivor. And that is all that I try to let everybody know who is struggling with breast cancer, because everybody, unfortunately, is not going to make it, but a lot of us are going to make it. And I guess it's that old cliche that say, some of us got to die for some of us to live.
Mm. Thank you, caller.
So I just want to say that there is hope.
Yeah, definitely. Thank you, caller. All right, so like she said, talking about it is a great way to learn more about the dysfunction and the problems that go along with.
Absolutely. And, we're in Chicago. We're very fortunate to have some really wonderful cancer wellness centers, cancer support centers, and many of my patients, like you, benefit tremendously from having that kind of support. And some of my patients really learned that they weren't alone with their sexual problem because these topics came up in peer support groups. The other thing I want to mention is, you spoke about the power of prayer, and certainly this means something different to everybody, but there is a very important spiritual component. Our lives, the sexual part of our life has a spiritual component to it, and it's one of the reasons why it's so important for people and women, not just people who've survived cancer, is that it's just a very special way of connecting with another person, and it feels like a loss if you're not able to do that. And so that's what we really try to do, is help people realize they're not alone. The problem is not just in your head, we want you to recover your whole self after your cancer treatment, and we want you to survive a long time. And if you're having trouble in the sexual aspect of your life, and not everybody does, by the way, that's important to say, after cancer, not everybody has these problems, but if you do, there is hope for you.
Great. So who all is part of the PRISM?
Yes.
PRISM Clinic.
So our team includes myself. I'm a gynecologist. I have two wonderful patient educators who are young women who we've trained to be knowledgeable about the basic educational and information. We have a nurse. We work closely with a gynecologist-oncologist, Dr. Diane Yamada, who's been a tremendous supporter and champion for this work. We have a partner in physical therapy, a woman named Dr. Judy Florendo. She's a doctor of physical therapy based in the community and is very, very experienced in taking care of both women and men with pelvic pain, sexual problems, and very competent in taking care of people with cancer. And then Dr. Shirley Barron, she's a PhD psychologist, a certified sex therapist, and we're very fortunate to have her in Chicago. She's a certifier of sex therapists.
Oh, wow.
So if you're a mental health professional watching and you're interested in becoming trained in sex therapy, Dr. Barron is one of the people in the country who is able to provide the appropriate supervision and training for sex therapist certification.
Oh, that's awesome. So you have a pretty comprehensive team.
We're tremendously fortunate.
Yeah.
We have a wonderful team, and I do believe the team approach is the way to go in terms of helping women recover their sexual function.
Great. So if you have any questions for Dr. Lindau, please give us a call at 312-738-1060. We are live, so give us a call. All right. So what should someone expect during a visit to your clinic?
Yeah. So the first visit is a talking visit, sort of like what we're doing now, which you're interviewing me. And we spend an hour. It took us a while to figure out what was the best way to use the time. Could a patient both be interviewed and have a physical examination on the same day, which would be ideal, be a little more efficient. But what we found after we've seen a few hundred women with cancer and sexual concerns, is that first visit is oftentimes emotional. For many women, it's the first time they're talking about these issues. A decent percentage of our patients have not even really talked to their partners about the problems. And we sort through together, understanding the cancer history, the relationship history, what their sexual function concerns are. And then we use a good portion of the time at the end to provide that basic education and usually some homework assignments.
Okay.
And the second visit is a very detailed physical exam. It's like a gynecology exam, but there's some additional elements. We actually offer our patients a hand mirror, a map of the normal anatomy, so they can look and understand what's different. And some patients have never looked down there before, honestly. So, and then at the end of that second visit, we're able to offer a treatment plan. And like I said before, some patients benefit from referrals to other specialists, and other patients can work with us directly. Usually not more than 5 or 6 visits would be a lot before we really see people regaining good function.
Okay. So treatment plan's different just based on the cancer, or is it the patient? Or
the treatment plan depends a lot on the presenting problem.
Okay.
So the most common problem that we see is a complaint of painful intercourse.
Okay.
And that's oftentimes because of those menopausal symptoms we talked about before. So dryness in the vagina that can cause painful intercourse. And there are a number of ways we can address that problem. some women develop a condition, not a lot of people realize this, but if you think about the pelvis, it's sort of like a bowl, and it holds up the entire, the whole torso and our anatomy and all the organs inside of our body. And the bowl of that pelvis floor is muscular. Those muscles, just like the muscles in your back or your neck, can spasm. They can react, sort of overreact. So a woman who's had painful intercourse, especially if it's happened more than once, when she tries again, those muscles can contract, they become really tight, and penetration is very, very difficult. So that problem can be solved with physical therapy, believe it or not. And sometimes there are exercises a woman can learn to do herself. Sometimes she needs the help of a professional. I think there are a lot of people who come to see us are surprised to learn that there are physical therapists who specialize in women's health and can actually help with these kinds of problems.
That's awesome. That's something good to know. I've never knew anything about that.
Knowledge is power.
Yeah. So are some of the issues treated just basically on counseling or medicine or physical therapy?
Yeah. I don't write a lot of prescriptions for medicine.
Okay.
There are a couple of reasons for that. First of all, there are really only 2 medicines that are approved by the United States Food and Drug Administration for treatment of sexual problems in women. One of these is estrogen for the treatment of dryness of the vagina, and the other one is a drug called ospemifene. Similar, a little bit different than estrogen, but works similarly, and it's for treatment of dryness. Now, neither of these medications can be used in women who have estrogen-sensitive cancers, and so hormonal therapy for many of our patients is not a first frontline option. So many of the treatments that we offer don't require prescription medication, and I think that's good because many of my patients are already taking a lot of medicine just to manage the cancer. But, it's not just strictly counseling. Like I said, that there are physical therapeutic components. Sometimes couples have been inactive for so long that working with a coach, so to speak, to get the conversation going again, somebody like Dr. Barron can be extremely helpful. Yeah.
Well, I was going to ask you, are partners involved in the treatment plan process?
Yes. So partners are always welcome. So we say that our program is for women and the people who love them. Yeah. And I would say maybe 10 to 20% of our patients bring a partner. Okay. And we are open to women of all kinds, regardless of whether your partner is male or female. We do include the partner if the patient wants to have the partner in the room for the history, the physical exam, the education. They are welcome. I do always, and I tell couples this at the beginning of the visit, I always like to have at least a few minutes alone just with the patient. And this is an opportunity for me to just sort of validate her experience, the way she would tell the story independent of her partner. And in some cases, I do see patients who are victims of domestic violence or abuse, and they can't safely disclose that with a partner in the room. So while it's rare that we see people who are actively in an abusive relationship, it does come up, and I think it's important that a woman should always have a few minutes of privacy with her doctor when she goes.
Good, good. So how do you make women comfortable talking about sex? That seems like a very comfortable conversation to have with someone you don't only see once a year.
Yes, right. I joke that some people are born with the talent of playing the piano, or they're great basketball players, and I was given the gift of being able to talk to pretty much anybody about sex. Why this is, I do not know, but I've just decided to embrace it. I think I was raised in a home where women's liberation, or women's rights, was part of the regular conversation. And while I didn't make it a habit to talk to my parents about their sexual life, they were proactive in educating us, and I never really saw it as a taboo subject. So I didn't realize I was any different than anyone else until really I was in medical school, and I realized that while the doctors who taught us told us you need to take a sexual history and this is how you do it, when they modeled the ideal history-taking situation, they always left the questions out. And that made me curious. I thought, I was convinced that these were important issues for people's health, and I wondered why the doctors weren't asking the question. So how do I make people comfortable? I think my style is just direct, it's honest, and I know that, for having that talent, I can help people. So it's sort of, it's catches on, it's motivating. I've really never had a situation where asking these open questions has caused a patient to be harmed or offended. And I think some doctors do worry that if, asking these questions could cause embarrassment. We never want to cause harm to our patients. And so I try to teach our medical students techniques, sort of basic techniques for sexual interviewing.
Yeah. All right. Well, if you're comfortable talking about sex, give us a call at 312-738-1060. All right. So do you ever discuss infertility with your patients at the clinic?
Yeah, so fertility issues are obviously very important to women, and especially to young women, reproductive age women, and cancer treatment can affect a woman's ability to have a future pregnancy. The patients I see who are coming with sexual function concerns tend to be after their reproductive years. Mm-hmm. I have some patients who were diagnosed with cancer during pregnancy and were able to bring a successful pregnancy to completion, which is just absolutely amazing. And where we have a big gap in knowledge is how best to talk to younger people, children and adolescents and their parents about the fertility issues and the sexuality issues. That's still, we need to understand that better. But if you're a young person or you have a young person in your family who's diagnosed with cancer or planning cancer treatment, you must come up with the courage to ask. If your doctor's not bringing up fertility and fertility preservation, people really need to ask those questions, because every day, practically, we have more options available to us. There's a terrific doctor, Dr. Teresa Woodruff, at Northwestern University, a PhD researcher who's one of the lead researchers in the world on fertility preservation in the context of cancer. So in Chicago, we have a tremendous strength there, and you must ask these questions.
Yeah, teamwork across systems.
Absolutely, yes. We have great talent in our city, and our institutions shouldn't be barriers to our working together. Right.
So how can someone learn more about sexual health concerns that are caused by cancer?
Yeah, so, the internet is your friend here. Maybe be careful at work, because sometimes the websites, if you're searching on sexuality, can be blocked. But if you search the terms sex and cancer, if you look at the International Society for the Study of Women's Sexual Health, ISSWSH, ISSWSH, this is an organization, they're having their meeting next week, an international organization that provides patient and consumer-facing information about this topic. The National Cancer Institute, the United States National Cancer Institute, the National Institute on Aging publish patient-focused information about sexuality and aging, sexuality and cancer. There's a lot of information out there, and some wonderful books on the topic, too.
Great. I think we have one last caller.
Hello.
Hi.
Hi. I wanted to ask your guest if she could speak to birth control and its impact on breast cancer rates. I've heard conflicting information about whether or not it increases or decreases your risk.
Overall, I want to say that the broad variety of options we have for contraception, for controlling our fertility, is really very, very important. And I'm a tremendous advocate of access to contraception and birth control. And I recognize not everybody shares my views. But for women's health overall, I think it's very important. When we use the term birth control, it's a very big term. There are many options out there. Some of them are hormonal pills or products. Others don't have hormones at all. Condoms, for example, are a very important way to prevent or reduce the transmission of human papillomavirus, which is the cause of cervical cancer. So there's an example of a birth control method that we know reduces our risk for cancer. In women who are at high risk of cancer because they have a family history, say for breast cancer, this I think is an important question to discuss with the cancer doctor or the general gynecologist. Another example, specifically with birth control pills, there's good evidence that birth control pill use reduces a woman's risk of ovarian cancer. And why this is, what the mechanism is still open for interpretation, but there is evidence that birth control pill users and women who have tubal sterilization or tubal ligation procedures are at reduced risk for ovarian cancer. So we have to take these different factors into account and counsel people according to their risk and according to their contraceptive needs.
Great.
Thank you for that question.
Thank you. Great question. All right, so we're running out of time, but do you have a website that our guests can go and look up on the internet to get more information about you?
So what I would recommend is Googling PRISM, PRISM, and using the words cancer or sex and cancer. I think that will be the easiest way to find our website.
Great, yes. Great. Thank you so much for being our guest today.
All right. And thanks for the call.
Thank you for watching. For more information, come to our website, which is www.chicagobreastcancer.org, to learn more about our organization, and you can call us at 312-942-3368 if you have any additional questions from today's show. Also, look us up on Facebook and Twitter. I want to thank you all for watching today. My name is Tarneka Manning with the Metropolitan Chicago Breast Cancer Task Force. We'll see you next month, third Tuesday at 5 p.m.